Our goal at the Mohawk Valley Health System Cancer Center is for our patients to receive the best and safest care possible, using the most advanced techniques and technology. Women with left-sided breast cancer who require radiation will have radiotherapy directed at the left chest, which is usually also close to the heart. To minimize the amount of radiation the heart receives, doctors have developed a technique called deep inspiratory breath hold radiotherapy, or DIBH for short. This technique involves taking a deep breath and holding it for about 20 to 30 seconds. Doing this inflates the left lung and moves the heart backwards, away from the area we are treating. Thus, while you are holding your breath, we are able to deliver radiotherapy in the safest manner, successfully treating the breast or chest wall and minimizing radiotherapy dose to the heart.
Before you begin your radiation therapy, we will image you in the CT scanner to obtain pictures of your chest. These pictures will be used to create a treatment plan specific to you and your body and to maintain consistency throughout your treatment. You will encounter some of the same equipment during the imaging process and during your radiation therapy.
We will do our best to accommodate you and make you as comfortable as possible. We always make sure that you have a cushion placed under your knees to relieve any pressure you may feel in your lower back.
For both the CT scan and your radiation procedure, you will lay on a breast treatment board in order to keep you stable and comfortable. You will have your arms above your head and hold on to an adjustable peg in the board or onto the beanbag that is formed around you.
This is to ensure that your arms are in the same position every day. After the simulation is complete, we are unable to change the treatment position unless directed by the doctor. This is the position that you will be treated in and need to maintain for each radiation treatment.
You will wear a pair of goggles that will help you visualize how you are breathing. A respiratory gating box will be placed on your lower chest to track the movement of your chest. A camera located at the end of the table will record the movement of the gating box while you breathe and hold your breath. This camera will transmit a visual representation of your breathing to your goggles and to the computer being monitored in the next room. Through the goggles, you will see 3 different colors of bars. The blue bar that you see is the threshold that you will need to reach by taking a deep breath. The yellow bar is your normal breathing pattern. Once the yellow bar has reached the blue threshold, it will turn green, letting you know that you are holding your breath correctly.
During the CT scan, we will provide you instructions through the intercom to take in a breath and hold it. After your scan is completed, the radiation oncologist will evaluate your scan by comparing the normal breathing image and the deep inspiration breath hold image.
Here's an example of the images we will review after your planning session is complete. As you can see, images from the same patient breathing normally and in DIBH position show how DIBH moves the heart away from the radiotherapy site and protects the heart. If you aren't able to tolerate the breath hold positioning, or if your heart does not move backwards when you take a deep breath, you will not be treated with the DIBH technique. However, you do not need to worry about damaging your heart. DIBH is one of many ways we protect your heart during treatment. We ensure that all of our breast cancer patients have a dose of radiation that is very safe, no matter which radiotherapy technique is used.
During your CT scan and your radiotherapy procedure, you will be asked to take deep breaths in from your chest like you're smelling a flower. You will feel your lungs fill with air. As you breathe in, try to visualize your chest expanding without arching your back. You will need to be able to hold this deep breath for several seconds at a time, so if you aren't used to this type of breathing, you may wish to practice at home before your procedure. To practice, lie on your back in a comfortable position with both hands above your head. Practice breathing so that your chest rises, but not your belly. When you have mastered breathing through your chest, practice holding your breath for 15 to 30 seconds. It's okay if you have to work up to this. During your treatment, the machine will turn off if you are unable to hold your breath.
Here are some exercises that you can do before your radiation treatment begins that will help you maintain your treatment position. Start by standing with your feet shoulder-width apart, arms held up and to the sides as you see here. Bring your arms back slowly within your comfort level. It will feel as if you are trying to bring your shoulder blades together. Hold that position for the count of 5. Bring your arms together in front and hold for the count of 5. Once you have mastered this motion, you can use a door frame to provide extra stretch. Next, lay on a flat surface and bend your knees or place a pillow under your knees to protect your back. Place your hands together and raise your arms above your head as close as possible to the surface you are lying on. Hold this for the count of 5. Return to the starting position. Breathe in as you raise your arms and breathe out as you lower them. The last exercise is performed from a hands and knees position similar to the yoga child's pose. Keeping your hands in place, stretch your back and lower your bottom toward your feet, stretching your shoulders in the process. Lower your head between your arms. You may choose to separate your knees in order for your bottom to get closer to the mat. Hold for a count of 5 and return to your hands and knees. All of these exercises can be repeated as many times as you need. Exercise within your comfort zone, adjusting to your own personal needs. Please consult with your doctor if you have any questions or concerns.
Thank you for choosing to receive breast cancer radiotherapy with us. You can be assured that our team will do all that we can to make your treatment as safe and as effective as possible. Deep inspiratory breath hold radiotherapy is a significant advance in treatment for women with left-sided breast cancer, resulting in the safest possible therapy. Thank you for your participation in making your radiotherapy as best it can be.